Hello, my name is Julie Hebert. I'm here to go over your benefits for Energy Edge Consulting, LLC. These are your benefits beginning June 1st, 2025. We did continue the medical plans with Blue Cross Blue Shield. Two of the plans will continue to be PPOs and one is an HMO. Please understand the difference is that a PPO, you can go to any doctor in the Blue Choice Network, which is the largest network. You do not have to have a primary care physician referral. With an HMO, you are in a smaller network in the Houston area. Hospitals like Methodist and MD Anderson are not in the HMO network. Memorial Hermann is, so there are some great doctors and hospitals in that network, but just be aware there are some significant network differences. You are required to have and designate a primary care physician, and that doctor does have to refer you to specialist. So going over the plans briefly, the PPO plan has a $3,100 deductible for an individual, $9,300 for the family. That's an 80% coinsurance. Once you've met that deductible, the maximum out of pocket or the most you would spend is $8,800 for an individual, $17,600 for your family. Something that's new is if you go see your primary care type doctor, your family physician, you will have a $0 copay. To go see a specialist will be $80. Preventative care on all three plans is covered at 100%. Lab and x-ray, you're subject to your deductible, 20% coinsurance. Same for imaging, inpatient, outpatient hospital visits, emergency room visits. Urgent care does have a $150 copay. Then you have your prescription drug plan, depending on if it's a preferred generic, preferred name brand, and then specialty medications. We do encourage you to use pharmacies that are in the network. That will definitely help with your out-of-pocket cost on prescription drugs. So the PPO plan and the HMO plan here are the same plans. The only difference in the coverage is that this plan on the HMO is in the Blue Advantage network, and you are required to have that primary care physician. But the copays, deductibles, all of those things that I just went over apply to the PPO plan and the HMO. Again, the difference is network and the requirement of a primary care physician and the requirement of the referral process. The HSA eligible plan is going to have a $5,500 deductible. And on this plan, you're going to pay everything out of pocket until you reach that $5,500. Then everything is covered at 100%. If you cover more than yourself, the max you would pay for a family is $11,000. Please understand that Energy Edge does pay 70% of the PPO plan cost, which actually allows them to provide the HMO plan to you and your dependents for free. The HSA plan is a little bit less expensive, so but they are covering 70% of this PPO plan for you and your dependents, which is very, very generous. So I know it's expensive, but they're shouldering a large portion of the cost for you. Be sure that you stay in network anytime that you can. On the PPO plans, you do have the out-of-network option, but you're going to get better coverage if you stay in the network. The pharmacy benefits, you're going to do better if you go to a Walgreens, HEB, Walmart, Albertsons. CVS is not an in-network provider for Blue Cross. Here's some information on how to use MD Live, and be sure that you're using your preventative care. That is included in your coverage, and there's a lot there available to you for free. This discusses the health savings account. So if you do have the HSA account, you can couple that with the high deductible health plan. You can couple that with an HSA account. This year, you can save up to $4,300 per person or $8,550 for the family. The dental, vision, and the life insurance this year is moving to MetLife. So we encourage you again to stay in network. Here's some information on how to find a dentist. There's an 800 number and the website. The coverage is staying the same. So it's still a $50 per person deductible. Then once you've met that, they're going to pay 80% for basic services like fillings and spacers and periodontics, endodontics. But things like crowns are going to be covered at 50% and orthodontia at 50% with a $1,500 lifetime on the orthodontia and a $1,500 annual dental visit benefit on your dental plan. There's your payroll deductions. Again, Energy Edge covers 70% of your cost. On the vision benefits, that's also moving to MetLife. So here is a provider link and the 800 number to find a provider. Definitely always stay in network with vision and make sure that the place that you get your glasses or contacts is also in network, because sometimes that can be something that will end up costing you a lot more money. You should be able to go and get your eyes checked for a $10 copay. Then every year you can get that done. And every year you can get new frames and new lenses. They're going to give you $130 towards your frame. You are going to have a $25 what they call a materials copay. If you decide you want to get contacts instead, it's $125 towards your contacts, but you can either do glasses or contacts, not both. Life insurance, Energy Edge provides $50,000 of life insurance, and so that's a great benefit for you. That's free of charge, so even if you don't get anything else, we want to make sure you get signed up for that. They also provide long-term disability, so if you are out after 90 days of being ill or disabled, you would be able to receive 60% of your salary, up to $10,000 a month. And again, this is completely paid for by your employer. Right now is open enrollment. This is your time to make changes during the month of May, and the changes take effect June the 1st. This is telling you that these changes, that the things that you deduct from your paycheck are not subject to FICA and income tax. So we have some restrictions around that. You can only make changes when it is a life event, such as marriage, divorce, loss of other coverage. If you have a question, please reach out to Matt Hobson or to myself, and we can help you with those changes. If you leave Energy Edge, you do have the option to continue through state continuation for 9 months if you want to continue your coverage. This talks about when you turn 65, what you need to look at. We will continue to use Ease HR this year. We've done that the last couple of years, so you'll be able to manage your enrollment yourself. Blue Access for members. This is a way for you to access your ID card and look at a lot of information from Blue Cross if you haven't already done that. Here's how to do that. Then I included some information in here from MetLife on the vision and the dental and how to find a provider. Lots of information there for you on what all the services that MetLife has. Then I also wanted to share with you that if you are when you're doing your actual enrollment as an employee, this is my test case here. When you're in here looking at your benefits, if you want more information about the specifics of what the plan covers, all you have to do, anywhere there's a blue hyperlink, you would click that link and it would take you to the full summary of that plan, of the medical. All the plans are there listed below. Then on the dental, there's also some additional information with the dental summary. This is going to show you more information, specifics about your dental plan. So that is the case in each of these plans. You'll be able to see where you have a summary listed, and you can get some more information about the coverage if you have any more questions. So my name again is Julie Hebert. I'm always available to answer questions. My email address and phone numbers on the beginning first page of this document. Please feel free to reach out to me anytime if I can ever help. Thanks so much. Appreciate you guys.